African American video to document that I doing surgery on an African American patient who has a receding pattern. He has a class 3 with thinning in the frontal area and the vertex as well. Patient likes to wear his hair shorts. That's why he want to do the FUE method. The FUE method will leave you no visible scar in the back, allow you to wear your hair short. You do have scars though, dots of scar scattered throughout the back like a mosaic pattern. It's very hard for people to see. Versus the strip method where you have a permanent linear scar on the back of the head and you cannot wear your hair short because people can spot you from a mile away. So with the FUE, dots of mosaic pattern, it's very hard. For the audience who would like to know more of my before and after of African American hair transplant result, just go on YouTube, type up black African hair transplant restoration surgery result 1 year post-op with before and after photo by Dr. Diep. Or you can go to my website at www.mataclinic.com under the before and after photos album. There's a few album for African American, frontal hairline, core, and vertex. You can just click that. Or you can call my clinic 866-999-6482. Getting back to this patient. So basically he's thinning in the front, receding on the floor. So my goal to roll his hairline to the level is appropriate for his face. From the eyebrows and up is around 6.5 centimeter. And then that's how we did the measurement. As you know, African American or Asian hair from the eyebrows and up is around 6.5 to 7 centimeter. And then patient opt for a 6.5. He would like to go for a 6, but due to the limitation of the number of grafts we do, I suggest just stick with 6.5 for now. He can actually go down to a 6 because of his facial structure too. But to be, we don't want to lower too much where we compromise the density. And another thing is, it's better to be a little bit high than a little bit too low. So that's where we are. The zigzag line going to be real tight, so we can do a small zigzag line. Unlike Asian or Caucasian where the zigzag line is much bigger, the African American zigzag line is small. Why? It's because most of the men shave their head straight anyway. On the temple, he's arched back a little bit, so we rebuilt his temple, as you can see. So we built it straight up from here and on here. So I put a marker in the middle because we'll go straight down the middle, and then from here to here is around 7.5. From here to here is around 7.5. So on average for African American, from the midpoint to the side is around 7.5 up to 8.5 centimeter. You can go as low as 7, but on average I would like to stick around 7.5. But it's all depends on the facial structure too again. And then the straight perpendicular down. As you know, the temple for Caucasians is a lot more acute, Asians less, and African American are less, and even perpendicular. Only female where you have the where the angle pointed forward. We will try to attempt to do around 1,500 hair graft today. As this patient, he's mixed, so that he has a little bit straight hair almost. So hopefully his root is not that curly, and then we will try to harvest as much hair as we can today. Hopefully we can get around 1,500 hair graft from transplant from the front all the way toward the back. Thank you.